Yeah, sorry for the little delay.
No, it's fine. It's fine.
So now. So,
Hello?
can you see my screen?
Not yet. It's gonna take a moment to link up. Yes, now it has. Yes, now I can see it. Okay, I can see your screen now.
Okay, you can see my screen. Beautiful.
Hello, good evening, ma'am. How are you doing today?
I'm fine, thank you.
Yeah, so nice to have you on the call today.
I'm happy I could join, I could make it, irrespective of the short notice.
All right. We're starting right away, and
Okay.
yeah, welcome everyone to another exciting episode of I Believe I Choice Facebook Live Chat, and want to say apologies to for the delay, and of course this was this was never our plan, but network issues always cause in sometimes. So, but then we just have to bear that, and then we move on. So, for today, we'll be discussing on um, preventing and treating urinary tract infections. And I know this is actually an interesting topic. Every woman should open ears to hear, not just women, because I know this also affects men also. But then I think it's more women are more at risk of this infection. So it's so important that our ears are open to hear and also share in case you have an equation, even as the discussion is going on, you can always chat. Of course, we ask the question, the speaker will attend to it. So feel free that you have the level choice party here. Of course, you know that we are always ready for you and to meet every of your questions, your sexual unmet needs that you want, and counselings that you need from experts in the field. So, as we commence, we want to take an opportunity to say a very big thank you to our amazing partners for their wonderful support. In short, Bella by Choice is still running because of their support. They've been like a backbone to us indeed. So we're saying a very big thank you to African Women Development Fund, Global Fund for Women, Women First Digital, Movement for Women Alliance, DKT International Nigeria, Cross River State Ministry of Health, UNFPA, and Cross River State Primary Healthcare Development Agency. Thank you so much for your support. All right, so as we proceed with the discussion for today, we would like to take some minutes also to introduce our speaker in the house. Okay, so we have, sorry, do I call you a nurse? Okay, fam. Oh, wow, that's beautiful. Having a look at this bio, I fall in love with it, and I'm so excited to really be one of the co-anchors of this section, to learn from you. Being in the field, I know there have been so many experience. So we're ready to let today. Okay, so Farm Namaka, not Lucy, is an experienced pharmacist with a passion for healthcare and a proven track record of 5 years in the pharmaceutical field. Sorry for that. So she's dedicated to ensuring patients' well-being through accurate medications dispensing, counseling, and promoting health education. She's also committed to staying current with industry trends and advancements. She's a detail-oriented professional woman, yeah, with a focus on optimizing medication therapy for improved patient outcome. Wow, that's beautiful,
Wow.
man.
Welcome, Mrs. Welcome, Pharmacy
Thank you so
Lucy.
much for coming on the call today.
Thank you very much. I appreciate.
Yeah, I wish to be like you someday.
You're already doing well at age like
5 years in
that.
this field
Everybody at the
is
same
not an easy
Really?
journey.
It's not. Yeah, so let's proceed with the discussion. The next slide, please.
Okay.
Okay, so this discussion for today has actually been treated earlier last year, and this is just a part two of the discussion of urinary tract infections. And of course, we know these are common infections that happens when bacteria often um, from the skin or returns, and then this enters into the uterus and infects urinary tract. Now, these infections are more common in women, just like I mentioned earlier. Of course, even women living with it might not really know that they actually have this thing in them
Yes, you're
until a
right.
step is taken to go for maybe running a test to know truly your health status, how how um, perfect your health conditions might be, and all. So and this also this usually occurs in the bladder or uterus. But more seriously, infections of this nature involves the kidneys and the rest of them. And then, so in this first part of it, we're just doing a quick recap on the last on the discussions that we've of this same discussion that we've heard from other speakers. So we'd like you to throw some lights on this, its symptoms, and then what you feel about what you know about urinary tract infections as a whole. Thank you, ma'am. Over to you, ma'am.
Okay.
Yeah, please. Can I request for a favor, please?
Sure. I hope it's something I can grant.
All right. Please, would like to see your face. Thank
Okay.
you.
All right. I don't know how to go. Hold on. Hello?
We are with you, ma'am.
Hi, Ma, we're with you.
Okay, so this is me.
Wow, you look so pretty.
Thank you. And
Yeah, I love these outfits of yours.
thank you. Good evening. And this is
Good
from
evening,
Lucy.
ma'am.
Yeah.
So once again, I wouldn't want my face to distract the plenty talk.
No, 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 no,
So
no, not at all.
we're going to be doing, do I have to be on video throughout? Start it.
Yeah, 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 yeah. I think that will communicate more to the audience.
Okay. So we've all
Yeah.
seen, it looks like you people have had previous talks about UTI, which is good because I feel the publicity is never enough. So it needs
Of
to
course.
I would encourage people to have another class maybe middle of the year and another one end of the year because it's one thing
Okay.
people easily overlook. I'm serious. It's one of the major
Mm.
causes of fertility in women and also causes
Hmm.
defect in children.
Wow.
People who are pregnant and have severe cases of UTI, so
Hmm.
it's most times affects the child. There are mild cases where nothing happens to the child comes out, but there are severe cases, and sometimes because of our poor health system, some people would rather not go to the hospital or rather think that end up causing more harm than good. So I feel I would encourage Age Network to keep hammering at it. It's very very underlooked. UTI is very very underlooked, and for some reason I don't know, as if it just goes in through one ear and goes out the other. People don't pay attention. So for myself in the pharmacy, I see a lot of cases and it's scary. Like recently I had a patient who came in and said, Mama, I want to wash my system. And I'm like, okay.
That sounds
What do you
funny.
mean by yes, exactly. I told her and I asked her, what do you mean by wash your system? Because I don't think it's dirty. She
Hmm.
said, my body they do me tanana. And I looked at her and I said, okay. uh quickly I asked the nurse, I told her, do you mind if we do some tests? She said, no problem. So I asked the nurse, let's take blood sample from you and do a blood pregnancy test, just so we're sure that we're not dealing with any pregnancy. Fortunately, she wasn't pregnant. And she was like, she already confirmed it that she took the PT strip. It's just she doesn't feel comfortable. So upon further questioning, trying to get her history and ask her, okay, are you experiencing pain down there? How often do you pee? Are you experiencing itching? Because from there, I got to find out that she's actually having UTI. Now, where the twist there is that she does self-medication a lot. So it's made it difficult that she happens to be resistant. Like when I asked her, okay, as your body they do you tanana now, what have you taken? Because obviously she has taken some
So,
things. But I take Amazi, work. I take I say make I call like
mm,
of UTI. I know people want to hear UTI. People just assume they are all under one banner. Yes, they are. But before before people go to before treatment of UTI is carried out, I usually advise strongly, please go for tests. That way we know exactly what we're treating for,
mm,
treat you with. So because there are different strains, different micro, it's important that we use that certain drugs might not work.
Mm.
And again, if you ask if it is for a person who self-medicates, it makes the problem, more difficult.
Difficult.
Yes,
Mm.
because such a person might have resistance to the drugs that you want to use. So it's important that they go for this test so that at the end of the day, the test would find out what strain of UTI would do
Mm.
the best drug to treat it. So the story is, of course, I told her to test. Then when you come back, then we can treat your body, and she was like, mama, it didn't work. Of course, you've taken drugs, it didn't work. So it's time you actually try the professional. So, and I had to tell her to wait for like 5 days so that the ones she has taken will leave the system
Mm.
so that it doesn't disturb.
Okay.
Yes,
The
because
new one
sometimes
she's going
one
to
of the
take.
dangers of taking self medication is that by the time you go and take it and then it doesn't work, if you go and run a test, you're going to get an error. So I had to tell her to wait 5 days first until after most of the drugs has been eliminated from the system before she can then run a test and then we'll now get result and treat her properly. So now to come back to the question of what we're dealing in today, it's something we see every day in the pharmacy, in a community pharmacy where I specialize. It's something that I can guarantee you, at least I can see 2 or 3 patients coming in with symptoms that match UTI. One of the common mistake I would advise is don't generalize it. They are all not the same. Always go for tests, first of all. I know some people don't think, but some people think only test is for when you want to confirm if you have malaria or typhoid, or when you think it's something, heavy. No, don't underrate it because UTI can cost you much, much, especially if you're a young lady and you're looking to have children, or if you're pregnant and you just don't want to take chances with your birth, with your child's health. Because if your child is healthy, then you don't have to worry about sepsis and other things that comes out when they are born. You try as much as possible to control what you can help. So after you've gone for the test and they've confirmed, then you can bring the test back or to your pharmacist who would interpret it and work with it. That way, when you're treating, that thing is important that you stick to your regimen. If your treatment is going to last, because the minimum is usually 7 to 10 days. Most people, once they get to day 5, they feel the symptoms are stopped and
I'm
throw
okay.
the
It
drug.
cannot happen again.
Exactly. Which it makes the next time you come, you find out that you're non-resistant. Of course, it takes a lot to be resistant, but nowadays, with the kind of drugs that they are making, I don't know, prevention better pass cure. So now that we have seen, I'm trying to sound an alarm of how bad it can be before I go into what it really is. So for those people, I'm sure we've met the introduction, we've seen what it is. Now let's go into hygiene. There are ways of treating these things. Now, if you're a young lady who is not sexually active, it's important you note that, who is not sexually active, you
Mm.
can have UTI whether or not you're sexually active. It's something that's they look face. Let me put it that way. They look face, so anybody can get it. But if you are not sexually active, your treatment regimen differs from somebody who is sexually active. Why I'm
Yeah.
pointing this out is because sometimes you see people they'll go to the pharmacy and they'll be like, my friend took it and it worked for her. So therefore, give me. I want to take it. Are you saying it now? What works for A might not work for B. And people keep mistaking that. you don't copy medications. So each individual is also unique. Yes, there is a general treatment, but try not to fall into the trap of always assuming that it is so therefore generally everything will work. It's not always the case. So try for a young lady, married or sexually active or not, married or single, UTI is something we all face. For whatever the case may be, it's advised that at least once a year you treat yourself for UTI. Once a year is advised, especially if you're sexually active. It's advised that you treat yourself once a year for UTI. Then how do you keep yourself hygienic? One of the first one is under hygiene, you have to make sure that when you're wiping your butt, this is funny, but a lot of people mistake it. I don't know how, but when you're wiping your butt, you go from front to the back. Go from front.
Sorry, Pam, can I interrupt you for a moment,
Sure.
please?
Sure.
Okay, please, before we move on to the hygiene, can you like tell us ways in which girls and women and girls contact UTI?
Oh, wonderful. Okay, you can contact it is something as little as your news. That's one of the first ways. Your nails. Like I was
Okay,
telling
your
you now,
nails.
yes,
Okay.
when you go to wash your maybe after using the restroom and you want to wash up, for people who prefer to wash up than using tissue. And even while you're using the tissue, if you're not careful, your nails has the most amount of bacteria. And it's so easy because
Um,
you pick and anywhere anything goes, and yes, it's advisable that you wash your hand as often as you can. So you have to be and conscious of it. That's one. Number two is holding urine for long. Once you're pressed and you don't pass it out immediately, you're endangering your bladder. And remember, this disease is called UTI, which means it's the urinary tract. That's the route where you go to pee. That's where it's endangered. So if you hold pee for too long, you're putting yourself in danger for this. The reason is because once the bag is this, the bladder is full, it begins to leak out. And once it starts leaking out from the sac, it causes the bacteria that pass out are not supposed to be there. There are places that they're not supposed to be stored, and then they start going there. So it's important that once you press, you pee out. It's not advisable you hold your pee for long. That's another thing. Some people believe, okay, in my profession, some people don't believe that toilets can cause it. But I firmly believe that if you use a kind of place that is not hygienic, instantly you will feel it. Why? Because bacteria from the environment can go in. I know the vagina is an opening,
very
which
sensitive.
means yes, which means something can come in and go out of it. Yes, so be very careful about where you use. If you have to carry your own sanitizer, you just spray it around and then use, especially when you go to public places. I mean, that's what I recommend anyway. So, and then somehow, um, it's people, there's this debate that UTI is related to STD, and they are both intertwined. Somehow they are, in the sense that when somebody who has gonorrhea or certain diseases, they can be transferred. And then after if you don't treat it well, some of the effects. What it does is that what I believe personally is that STD leaves you predisposed to UTI. That is what I believe anyway. Or UTI leaves you predisposed to STD. That's how I feel they're related. Not that one is, they are both on their own. It's just that if you have one, the possibility of you having the other one very easily is there. That's how I see it. So I hope I have answered the question of how you can get UTI.
Yes, ma'am.
Wow, that's
So
beautiful. Thank you so much for sharing that. I would like you to rephrase on the area of you were earlier you mentioned about how they can wipe themselves while using the
Oh,
toilet.
okay, yes,
Yeah.
that's
So would
hygiene.
like you to throw more light on that.
Okay. When you use the toilet, remember this is your front and this is my back. So when you're wiping your ass, you wipe from front to the back, not back to front. Because when you do from back to front, you're bringing germs from the uterus. Remember, when you sweat, even if you didn't pee or just because you went to pee, when you sweat, there is a thin line that's your buttocks, the division there. The sweat runs down there.
Mm,
You leave it for once, so it gives some people, that's, that actually causes some people body odor. For people who don't,
yes.
bathe, if you, that's why that's one of the reasons they recommend you to bathe twice a day, because of that
Mm,
that could be hidden in some places like that. Now imagine when you wipe your butt from back to the front and you're carrying all those rishis to the front. Remember, the vagina is an opening. It's an opening. So and anything can fly in. So it's important you wipe from front to the back when you're wiping your ass. That's one of the hygiene way. Another thing is it's recommended you use temperance instead of pad or towels, sanitary towels. The reason is because when you use sanitary towels, sometimes you have to start, especially those very long ones that we're more comfortable with, so that it doesn't stain your clothes. Unfortunately, they make it easier for the bacteria to move between the vagina and the ass, especially when, it's when it stays longer than 6 hours. It makes it easier for the blood becomes like a form of what they call it, vector, that now helps to, transport the bacteria. That is why temperance it's more recommended. And if you must use pad because of your, financial needs, it's advisable you change as much as you can, and always wash up. Every time you use the toilet, wash up. Every time you use the toilet, wash up front and back, so that you reduce as much as possible the way you can, the flow of bacteria. Yes, that's it on the hygiene. So we've talked about, under hygiene, we've talked about the way you wipe your ass and what you use. Now, one more thing I'd like to leave. Okay, that's it for the hygiene. Then, oh, one more thing is bath. For people who like to take long baths, they fill the water and stay inside. They need to be conscious of it, because the soap, the chemicals from the soap, the water, what you're washing out from your body. Remember, the vagina is an opening. So it can, if you stay too long, rather than it helping you, it ends up causing damage. So that's something you should have at the back of your mind for those who like to enjoy baths or stay in water for too long. Now let's come to clothes. And when it comes to clothes, of course, we all know you have to wear breathable materials and not things like silk that don't allow air to flow, or jean that don't allow air to flow. If you must wear them, don't wear them for long. And when you take them off, try and let everywhere breathe. That's why they advise you not to wear undies while you sleep, so that, everybody can breathe. That's
Yeah.
it for the clothing. Then when it comes to medication, try to complete your medication if you're given one. Number 2, avoid self-medication. And then number 3, always run a test before you treat for UTI. I cannot overemphasize it enough. Always run a test before you treat for UTI. So
All right, thank you so much for that, fam.
okay.
Maybe I think you can rephrase that in our own native dialect. Use pidgin, make them understand where we're.
Which one you want make I use pidgin
Because
for? Enough now, people
use
are
this one when
talk
they
for
use
my
now because
question.
if you like say as they use the big English, you go say this one. They don't they talk. Me, I don't understand the language where they talk. So you go talk the
Yes.
language where they understand.
Yes, most times that is how they tell you. They tell you, to your face that I don't understand what you're saying.
That's so.
So sometimes you have to switch to pidgin. Most times I switch to pidgin, and
I beg
then
now. It's with the switch to now with the switch now.
okay, pidgin it is then. I
All
beg
right.
go. Hello, now women are we plenty pass. When they
Not
Na
true.
so
say
na us
women
dey.
plenty pass man.
Yes, so women more now put here because this one no be play
At
no be
all.
play thing. Ah,
Make you no be
So
like say person wan born, e no go fit to born o. They go dey ask am say, madam, dem tie your kini for village. They no go know say
yes,
na
so
ordinary UTI dey use am dey play. E go dey waka from
okay,
one part to the another. Dey find who do am for village. You no go know say na something wey be say if you go hospital, kpakpa they don treat am.
that's so.
So it cannot be overemphasized. So my people, abeg, if make we dey take care of ourselves. 90%, or
It's
rather, let me
important.
percent of the treatment
yeah,
comes
that's
from
very true.
so make we try to keep our body, sepense, selense,
I mean now,
try wash up,
Mm.
eh? Try the wash up. And if you dey wash up, they do from front to back.
front to
No,
back.
yes, no, they clean from back, come front. No. They clean am from front, they go back.
Okay,
Sugar,
All right, thank you very much,
we done
thank
here.
Lucy.
Thank you very much, ma. So can we move to the next discussion, please?
you.
Next slide.
I
Yeah,
get
she has not
question.
actually answered this question, which is what are the differences and similarities between UTI and STI? Are
I think
UTI
she has
also
done
transferable like STIs too? The
No.
similarities and differences.
Oh, okay. First of all, the similarities is that now for the same but place, like the same region of the stomach, all of them, they
Okay.
start like point of contact. It's through the vagina.
that.
SCI, just as his name implies, is sexually transmitted. Then UTI are from the same uterus they take enter. So they both have same point of contact or same point of entry.
Okay,
But
you
then
know,
the
say this
difference
thing wey you just talk now, they very very important because even one woman don't do test, say she gets UTI. Now you don't
Mm.
translate am o. They can't say now because you don't go sleep with one man. That's why you get that infection. So I know say with wetin they talk now, they go open ear here say no be the same thing o, na different thing.
no,
Okay.
it's not the same thing. But if you have one, the possibility of having another, e dey.
Abi.
Yes, it's
Mm.
yes. Like
So
if
in
how do I put it? If one hand gets oil, just know say the possibility say
the other
the oil go
will
rub
get
You go
enter
get
inside.
am. Oh, na
your.
So
so.
Sam Lucy, if I'm correct, when it comes to UTI, so it's your infection, my infection, it's not something that can be transferred from one individual to another.
No, it is not.
Thank you very much, ma'am.
But you can be exposed to it.
Okay.
If one person in a house, like if you're in a room filled with girls, and one person has UTI, and she is sharing the same toilet with everybody else, there is a possibility that other people might
Have it.
might get it. Yes.
Hmm.
So it becomes transmittable, but not infectious. I don't know if you get the difference. Something can be transmitted from one person to another using, if there is a medium, that means there is something that is carrying it from me to you. Just like
From
mosquito,
this.
now if mosquito bite, they bite you before you know it, you get malaria. But you go get malaria, you go sit down. I feel can't rub body for you. You get. I don't know.
Okay.
I'm trying to
Yeah.
explain the difference between
I understand.
infectious and transmittable.
Okay.
It is not infectious, but it is transmittable. I don't know if I'm making sense.
Sure,
Yes,
sure,
ma'am,
we
you are.
understand. Thank you so much for that. Okay, so can we move to the next discussion, please? All right, so what I think she has discussed about this. The only area I think she has not touched is dietary habits and
Yes.
that contributes to preventing UTI.
Oh, okay. The long and short of UTI is avoid sugar. You can avoid
That's a new
soft
one
drink.
I'm hearing.
Are you kidding me? That's like the number one
Yes.
thing. I mean, personally, I tell my patients anyway.
Really?
First of all, avoid sugar. If you can avoid sugar, especially the ones from soft drink, all those your sharp sharp, you put it go, you gulp it. I think
Madam
what started
Lucy, Pharmacy Lucy is not our soft drink.
okay, sorry, I avoid taking it as much as possible.
Okay.
So I tend to forget that it's not everybody that's like me that is avoiding it. One time one time we had a class, a couple of us, a group of us came out and we are like, okay, let's try this as an example and let's see what happens when you don't take soft drink. And this group of people who liked soft drink, like, yes, we'll volunteer. We'll be taking soft drinks. And then for people like me who didn't take, we're like, okay, let's see what happens. We weren't looking at the weight aspects. It was just what it does, what it predisposes you to. And we found out that those who took sugar more had they were easily like even though this spanned for a semester, which is like 3 to 4 months, and during those 4 months, each of them, there were five in number, each of them had treated at one time or the other for UTI, as opposed to the five of us who abstained from soft drink. So it's been tested. I'm sure I'm not the only one who have carried it out. I'm sure there are a lot of research that has done it. But personally, when I come in contact with my patients and I tell them avoid soft drink for the next 2 to 3 months, they come back with good results. So sugar is one of the ways, diet speaking, that I know that can avoid UTI. Another thing is water. Drink a lot of water. Another thing you can try is yogurt. Yogurt is good. That's fermented milk. It's good because it helps to, it helps to create floras in from the intestines, then they send some of them down to the vagina, which is healthy. Another thing you can do is cranberry. That's one fruit that is especially designed for UTIs, for ladies, and anybody can take it. But if you are able to get the tablet and you're taking one tablet a day, you find out that you would, for a very long time, you will not have a cause to worry about UTI, especially for somebody who is constantly being treated, who is having recurrent UTI. By the time you start taking cranberry, be it the juice or the tablet or whichever one you can lay your hand on, it automatically increases your chance of um having a clean UTI tract, because that's what it works. That's its job. It just helps to keep the bacteria there on the low. It's like a police. If you do anyhow, you see anyhow. That's how cranberry works. And one thing with nature is that nature always provides. I've heard some people talk about keto diet helping, but I really don't buy into that, being that keto diet is simply you avoiding sugar. So if you take out the sugar, of course, everything goes down. So my number one for diet is avoid sugar, especially refined sugar. Number two is take a lot of water. And then number three is go for cranberry. Cranberry tablets, fruits, juice, anyone you can lay your hands on. That's it. So thank you very much. Do you have any other
Thank you.
question?
Yeah,
Yes,
thank you
we have
so
one
much,
last
ma'am.
question.
All right.
So before the last question, I would like to ask you a question because you kept saying go for test, go for test. When you go to the hospital for test, what is there a particular name you call it? Because I know of urine culture, but I don't know if urine culture also works for UTI. Is there a
Yes,
particular name of test?
yes, you can tell them that you want to do in HVS. That's high virginity, high vagina sensitivity test.
What's the
HVS,
short form you call it?
HVS test.
Okay.
Now, what this test does, it shows us the exact drugs that your that you take and you'll be sensitive to, or you'll be resistant to, which means when you run the test and you bring the results, it comes in two forms. The first one shows us what what you're actually suffering from, the bacteria that we are looking at fighting. And then the second one shows us exactly which drug is best for you to take.
Mm. Wow, thank you so much. Thank you so much, ma'am.
So go for HVS. That's the name of the test I usually recommend for my patients or to my customers. Go for
All right.
HVS.
Wow, that's beautiful. Thank you so much for sharing that, ma'am. I think I also have a question as regards the sugar stuff. When you did talk
Okay.
before, you mentioned say maybe we know they drink soft drink. So for
Mm-hmm.
people will be saying that they
You
use our
should
drink
just
step
don't
down.
say for people. Say like me now that used to take something.
Okay, like us now, where they use like step down. You know, say if you don't chop, you go feel like look, I use the cold one now, step the food down so I go balance well as we dey
Okay.
do. So that means we are limited to some that we should take. Okay, so now tell us if we are not taking, are you saying we should not take at all, or make we dey take some? So if we dey take some, which one we fit take?
First of
Soft
all,
Aside from this yogurt
all of them,
and
sugar
the
and sugar. They let them package
villagers.
that
I'm not like you got.
yogurt wey
sugar.
dey
Now,
sweet now.
yes, now sugar. Yogurt doesn't have sugar. It comes on sweetened. Although there is sweetened ones, though the ones that have sugar, which I don't recommend. I recommend for unsweetened ones. But as for soft drink, sugar na sugar. They just
Ew.
they look
So what
sweet.
about malt now?
Make your own drinks now. You can make
You
your
do
own drinks.
I mean no do when you open them and
Exactly.
sugar.
Once you do shh, now sugar. Thank you very much. Yes, once you hear that.
All right, thank you so much.
So
So we'll
honestly,
move to the next discussion.
if you can go on a soft drink fast for just 6 weeks, I'm telling you,
Mm,
the changes are going to be amazing. Starting from your menstrual cycle down to your
mm,
sleeping cycle. Like literally
mm.
even your skin will thank you. If you have a lot of
Wow.
acne during your period, everything drops. Like you begin to wonder because the amount of
Mm.
sugar in that, I'm not sure is equal to the container. The container is probably giving us a lesser version. I'm just being paranoid about it. But the point is avoid soft drink. Your stomach would thank you, your system would thank you. If you can afford to do
Mm,
that for 6 weeks, oh my God, the results are amazing. The
mm.
results are amazing.
I'm going to do the trial.
Don't
I
worry,
go start up
I'll be monitoring you to be sure you carry it out.
as
Oh,
so.
you guys do
Okay, all right. So before we come to the conclusion of today's discussion, we'll be taking this last question. What medical interventions are commonly prescribed for treating UTIS?
Eh, and this is where the problem is. All the medical interventions are uh, you need prescription for them.
Okay.
And because it's a prescription drug, it's not something you just say out in the open. It's
Okay.
against our ethics to list out names of products. Now, if it were to be something like paracetamol, which is over the counter, of course, that would have been a problem. But all
Hmm.
antibiotics prescription drugs. And for that reason, you don't just say it out. So I would advise, please go with prescription and take it
Hmm.
according to prescription. It is a prescription
Wow.
medication. Now, the only one I can tell you that you can get over the counter is cranberry, which I'm sure they sell it in tablet. It's under supplements. So you can go for
Sorry,
cranberry.
you said
Add
cranberry.
cranberry.
Cranberries.
Cranberry. Okay.
That's a wonderful supplement to go. I think that's one of the things I listed as what you take too. If you can get
Yes.
the seeds, the juice, any which way you can get it. But the most common one in Nigeria here is the tablet, which you can get on the
Hmm.
supplement section of your pharmacy. That's the one. Then
Okay.
as for the medication, it is a prescription. So please go with your prescription or come with your lab results. They go a
Hmm.
long way. So because the prescription medicine, I'm sorry, I can't just list names. So I believe that's it.
Okay, so we just got one question from a woman. I believe we just asked, though it's different from what we have as today's discussion. The question says, um, does is there any infection
Mm.
that is related to these pimples that comes out from the human face? I don't know how to put it, but that's how the woman put them. So explain them like that. Okay, now let's say person gets
I get
infection. Say infection fit cause pimples or maybe say no go stop. If you go come, go come,
it.
go come, you know.
I get it. I once had a case of somebody who had severe acne, and then we had to do
Hmm.
some prescription drugs to take care of it. So,
Okay.
as for acne, you know, same way pain is your body's way of telling you that something is wrong. That is the same way
Hmm.
acne works. Acne is your body's way of telling you that something is wrong. So,
Hmm.
yes, to answer the question, yes, there is a possibility that certain infections can manifest or show their symptoms in form of acne in the face. But
Okay.
it's called a secondary symptom, which means
Okay.
it's not that important. Primary symptoms are the ones that once you look at, then you know that, oh, yes, this is what this person is going through. Just like somebody that is shaking and having fever and having headache and experiencing tiredness. Once you see that, what's the first thing that comes to your mind? Malaria. Or,
Hmm.
and the person probably has bitter taste, experiencing bitter taste. Once you see those
Hmm.
symptoms, the first thing that comes into your mind is malaria. Then
Malaria. Okay.
for some people, their secondary symptoms might now be experiencing joint pains. Are you seeing it now? So
Hmm.
sometimes acne can come in as a
Yeah.
second symptom for certain kinds of infection, but it's mainly things that affect the skin. Things are topical.
Hmm.
That is when it usually shows up that way. But to answer the person's question, yes, some acne can be related to infection, but it's best to find out.
Okay. So. Hmm. Okay.
There are
So can is that actually related to UTI or STI? You know.
no, 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 it's not. It's not. It's not in any way related to
Okay.
UTI.
Okay.
No, it's have such relationship.
Oh, okay. All right. Thank you so much for the beautiful answers.
Hmm.
I would say plenty women when they listen to this
And
talk today go don't learn plenty things from waiting you
I
talk.
have a
Us when they
question
like
before
sugar,
we go.
sugar.
um,
Uh, okay, please go ahead.
So I just want to quickly ask, so because I just remember something I read online this past few days. Smelly vagina, is it related to UTI or STI?
both.
Both. Okay.
Wow.
It all depends on the
That's
micro.
interesting.
That's why I said it's important to run a test. Certain microorganisms can cause smelly vagina, and there are different kinds of
Mm,
smell. There
mm,
is the foul smell, there's the fishy smell, there's the I don't even know. I know there are different kinds of smell and different kinds of the smell. So both UTI and then STI can cause both.
mm,
It all depends on the microorganism that is causing it. Particular microorganism at the moment that is causing it. Another thing you need to understand is that somebody can have both STI and UTI.
okay.
Really? Both of them as well.
Yes,
Mm,
you can have both at the same time. And with
mm,
conditions in UTI, you can have complicated UTI and you can have uncomplicated UTI, which is the reason why I keep hammering on tests. Test shows us all these things. If it's detected early, then you can take further, heavier antibiotics or combine one or two antibiotics
mm.
to have answered your question.
Yes, you have. Thank you so so much. Do you have any other question, or does anyone else have a question as we wrap up?
Give up sugar. Give up
Oh
sugar.
my
You're
god!
not looking happy to me.
I will actually think about it. I will think about
You are still thinking
it.
about it.
No, I will think about it. All right,
So,
well, thank you so much for coming on the call. It was really, really an amazing and interesting conversation. Yes, I would say I've learned a lot. Yeah, personally. Hmm.
It's
You see
so
this? You see
that sugar,
that
Abby.
Fanta, that Pepsi, and then the alarm pass me. Oh. So with this, of course, there have to be a U-turn. All right. So are you a woman with an unmet sexual and reproductive health needs? You can actually reach out on Ali Chatbots with the number on the screen, or call our Honey and Banana Connect line. You can see the number of the screen too, 7790. So this number now free, you go fit talk, and then you go get all the information when you need to. So no waste time. Call the number sharp sharp. Okay, so if you dey far away, maybe for Calabar or Lagos, you fit reach any of the centers wey dey for the screen. So okay, also once again want to say very big thank you to you our speaker, Fam Lucy. In short, you are now my friend already. You are now my friend already. So I believe there's still more to learn from you. And so women, stay tuned for more information. In case you get question after listening to this one, no hesitate to reach out to, because we still get better gist for you. So if you follow
Yes,
us
so
again on Twitter, Instagram, Facebook, we dey there. We go dey yarn you. You fit even visit YouTube too to continue to hear this story wey we dey talk now. This one no be just ordinary story, but na yarn wey we dey yarn wey be say na your reality. So make you no sleep. Forget say your health na your wealth. Your health na your power. If you no get am, you no get am o. If you no dey alive, you don lose. So dey tuned o. dey alert, no feel ashamed say I fit get STI o, I fit get UTI, so make I no kuku talk, make I shut up, make dem no laugh me. If you keep quiet, you go die for silence. So as our people dey talk, no be say dem dey talk in vain, dem dey talk so that your life now go dey important to you. So now, as we come to the conclusion, we are looking forward to having all of you again on the next discussion, same time next week, Thursday. Bye.
Bye.